In January of 2022, a few important changes took place that have resulted in a lot of anxiety and questions coming from the patients we're seeing who are members of Charlotte Fire Department. And I thought I would take a moment to try to address some of those concerns and provide clarity. Since 2019, we have been providing the city with annual examinations that include all the elements of the NFPA 1582 standard. In 2022, a couple significant changes occurred. The first is a revised standard was published by the NFPA. And the second, and most notable, is that the City of Charlotte decided to transition from an OSHA respirator clearance determination to a full NFPA 1582 standard. So while we've always done the same exam, in the past, we only made clearance determinations based on the OSHA standard, which is admittedly broader and more discretionary. I'd like to take a moment to help you to understand what to expect from the new process. Let's start with the letters. NFPA has two categories, Category A and Category B. Essentially what this means is that when we look at each medical condition, a Category A condition would be one that is a full stop. There's something very serious about this that impacts a member's ability to perform their essential job functions. Category B, on the other hand, really depends on the particular situation and the particular patient's case. So an individual diagnosis may impact their essential job functions depending on whether it's controlled or uncontrolled, new or established, whether appropriate management and treatment is underway. The City of Charlotte also has a letter grading scale that helps provide a little more detail. But it can be confusing to members because it essentially runs the opposite direction of the NFPA letter ratings. According to the Charlotte Fire ratings, there are 4 categories. Categories A, B, C, and D. They are still all the same medical conditions using the same standards that are in the NFPA. And I'll tell you a little bit about what they mean. So a member with Category A determination essentially means that their entire exam was normal. The history that we've taken, our exam findings, all the labs, all the diagnostic tests. Essentially, there's nothing there. Category B, on the other hand, means that we found something, but that something really doesn't affect any of the essential job functions. And so, an example of something like that may be a member that we find elevated cholesterol. We found something, it's relevant, we want to address it, we want to educate the patient on how to manage it, and that may include lifestyle modification and/or medication. Category C finding, on the other hand, is a finding that does impact a member's ability to perform one or more of their essential job tasks. It is, however, perceived at least to be potentially temporary. So, something that is reversible. We can intervene with treatment, medication, lifestyle modifications, sometimes just time, and we're able to reverse the situation and get the member back to meeting all 14 essential job functions. Lastly, a Category D finding is the same as Category C in that it impacts one or more of the essential job functions. The difference being that there's no reason for us to think that it's reversible. So a Category D finding would be something that's going to impact that member for the rest of their career. So when a member has a Category C or D finding, it means that it's impacting their ability to complete one of their essential job functions. We determine what those job functions are, and that's what's communicated to Charlotte Fire Department. At that point, the fire department is going to intervene to make sure that that member has modified job responsibilities that preclude them from doing anything that would put them at risk, eliminating their need to complete one of those essential job functions. In the case of a Category C finding, we're actively pursuing resolution. So that can include things like nurse case management, health coaching referrals, physical therapy, exercise physiology, seeing either the member's own primary care provider or a member of the Marathon Health Clinic network, and when appropriate, specialty referral. In some instances, it means additional diagnostic tests to get to the bottom of what's going on, or if a diagnosis is already known or quickly identified, then it's initiating necessary treatment to reverse the situation. We're here to help members stay at work, and in the instances where they have to be temporarily held out of work or work with modified responsibilities, our goal is to get them back to full work as soon as possible, because we understand that that's what firefighters want to do. Another important thing that Charlotte Fire has done to help with the transition to full NFPA 1582 is allowing us to use a provisional clearance status. So a member who has a Category C rating, a finding that impacts one or more of their essential job functions, but we have reason to believe we're going to be able to resolve relatively quickly, and in instances when we believe an individual is not at risk to themselves, their coworkers, or the community, continuing to work at full duty during that provisional time period, we keep them at work. We keep them on the truck doing their normal thing. That may be while we're working up to find additional details about the condition or initiating treatment. An example of that may be a member who has diabetes, and their diabetes has become uncontrolled, but they're motivated to make changes, we're able to make medication adjustments, and we're able to get them back on track. During that time period, we may feel that the member is safe to continue working, but we know that it's going to take a little bit of time for their labs to demonstrate the improvement that has been seen with the changes that we've made. And so we'll put that member into a provisional status for a few months and have them return for repeat evaluation, and at that time hopefully be in a position to provide full clearance. While there are frequently times when it's safe for a firefighter to continue working at full duty during this provisional period of time, there are situations where that wouldn't be reasonable or safe. And in those instances, we will recommend modifications to job responsibilities during that provisional time period. To be clear, our goal is always to have everyone at work performing their full scope of duty in a safe way that keeps them healthy, keeps their coworkers safe, and keeps them doing what they love in a way that maintains the safety of our community. I often get asked what information is shared with the City of Charlotte. We absolutely don't share personal and private health information without the expressed permission of the patient. And so often questions that come to me from the city are based on information that the firefighter has shared with their supervisors or members of their team themselves. But even in those instances, I don't corroborate the information or share any private information unless the firefighter knows that I'm going to do it and they've given me permission. So what we communicate to the city is whether an individual is fully cleared without restrictions, whether they meet the OSHA respirator standard, and if there are any restrictions to essential job functions, what those are. Another question I'm often asked is how the personal physician and or specialists of a particular member play into this system. And so we value all the members of our medical teams around our community, and it's important to get feedback from specialists and providers that know patients. We are the experts on NFPA and on the essential job functions of Charlotte Fire Department. They're the experts on particular organ systems, and so we collaborate to see how that information translates. It's important for me to get feedback, whether in the form of notes and documentation or personal conversations with a specialist or provider. That may be a pulmonologist, a cardiologist, endocrinologist, neurologist, the list goes on. It may include ancillary services like physical therapy, audiologists, vision services. All of those are important. But all of those folks, as expert as they are in their field, often know very little about the NFPA 1582 standard. And so I'll share the standard with them, we'll look through it, we'll discuss the particular findings of a particular individual, their particular case, and then ultimately it is our responsibility to make a recommendation to the City of Charlotte. Charlotte Fire Department then employs their own human resource protocols according to their policy. So we make a recommendation, and then any changes to job responsibilities or duties are at the direction of Charlotte Fire Department. Even in instances when a member is actively involved in the treatment of their condition, the particular treatment of choice can be influenced by the fact that a member is a firefighter. So the way a condition is treated in that instance may be different from someone who works in a different industry. For example, there are some medications that may impact the ability of a member to safely perform their job. And so in those instances, we want to work closely with the treatment team to ensure that an appropriate treatment regimen is being employed and modifications are being made that allow us to eliminate the need for a particular medication that can be a potential problem. In some instances, there is no other alternative treatment. But in most of those instances, it's safe to say that the underlying condition itself may have a similar impact on the safe performance of the essential job function. And so it's always important to have dedicated conversations with the public safety health team, as well as private physicians and specialists before making the independent decision to discontinue any treatment or medication. Questions come up about as-needed medications, and that is really a case-by-case basis. Very infrequent, intermittent use of a medication that has restrictions and can be used only in instances when the individual is not working may be no problem at all. But if the individual is needing to use the medication frequently or potentially need the medication at times when it may overlap with work responsibilities, then it can be a problem and we need to look for alternatives. In the instances when these restricted medications have been prescribed, it is important for us to have pharmaceutical records to corroborate the frequency of use and make our treatment decisions. I know that everyone who is a firefighter is dedicated to their career. And it is important that I try to alleviate the anxiety that can be associated with these examinations. We are partners to every firefighter in trying to maintain their health and their safety, for their sake, for the community's sake, for their family's sake. And we want to accomplish the same thing. We have the same sets of goals. I can reassure you that there are a very small number of firefighters that have to have restricted job responsibilities or be held out of work. But I also know that if you are one of those small number, it is not inconsequential to you. That's why it's important for us to support you along the way, make clear what our treatment recommendations are, make it exceedingly evident how we came to that determination, what the risks are, and what we need to do to resolve the problem. We have nurse case management, physical therapy, behavioral health to help along the way. And even in instances where it isn't directly related to the condition that is causing the restriction, it may be a good idea to talk to one of our counselors about the added stress of navigating this process. We work as a team at the public safety clinic, and I really feel strongly that we've put together an excellent group of experts. But I also know that there are times patients want to speak to me directly, because every single person who is either not cleared or put into a provisional status, their case is reviewed by me personally. I discuss it with the team, I look at all the data, and help guide a decision. And so there may very well be reason for an individual firefighter to want to speak to me directly about their case, even in the instance when I didn't do their original exam. I will always make myself available by phone, in person in the office, or by virtual technology such as Zoom to ensure that every firefighter has the opportunity to ask their questions and have their questions answered directly. So what are some things you can do to ensure smooth sailing through the process? First and foremost is stay calm. We really are not that difficult to get along with, and we're in your corner. Next, make sure you're taking your health seriously, not just because of this exam, but because it's important. Make sure that you're following up with your primary care provider, seeing your specialists. Make sure that you're actively engaged in the treatment decisions that they're making. Make sure that if you're having trouble complying with the treatment, that you let them know that there's a barrier because of the cost of the medication or the burdens of side effects. Make sure that you're actively involved in managing your disease process appropriately. And if you're struggling in any way, get involved. Get a follow-up appointment. If you need help, we're here to help. Talk to us, give us a call. We'll help coordinate care. If you're not getting the answers you need, we'll help find the answers. So it's important to make sure that if you're seeing other providers in the community, that you're seeing them shortly before your birthday month to ensure that everything is neat and tidy, that you have timely office notes available, and in some instances to ensure before you come to see us that your disease process is well controlled. It's also important to let them know if they're making medication decisions that you are a member of the fire department, and there may be medications that would be ill-advised if they're sedating or impact your attention or your ability to concentrate or stay awake. Even though you may only come to our Midtown clinic once a year for your annual exam, we're there all year round, and we are engaged in your health and safety from the moment we meet you to the moment you retire. So if you need anything along the way to help keep you healthy, to help keep you safe, or if you need any questions answered, we're only a phone call away.